Obviously, coming out of COVID and the impact of COVID on our communities, particularly on the social infrastructure and the deterioration of some of the support systems that help people recover and get better. I think no one could have ever predicted or thought of the impact that COVID will leave behind, the aftermath of that, right? So I think that is, we're seeing that being played out on our streets every day. We're seeing that in the form of increased houselessness, mental health issues, ongoing crisis of drug poisoning in our city, and the gang violence, all that, right? So I think those have been pretty top of my mind, even though as mayor I have very little control over those things. We can do what we can, and we have been, but it rely a lot on other orders of government. So I've been working hard to build that relationship with provincial government, and have a good relationship with the federal government, and building on those, right? I think the message I want to convey to Edmontonians is that the things that we control, I think we got a good handle on, and we are improving those services. We are improving and investing in Edmontonians' expectations to improve those core services. And where the challenges remain are on the social issues, and that is absolutely is on top of mind for a lot of Edmontonians, and that's where I will continue to do what I can by building stronger relationship with community and partners and other orders of government, and continue to advocate at the same time step up. I think we have stepped up. I think even on social issues, we have built more housing over the last few years than we have ever done. Close to 600 supportive housing units have come on board. Significant investments made in the crisis diversion program during the last budget, and in encampment response. I think we're doing what we can on those issues, and so I understand that the province has committed to invest close to $10 billion over the next decade to increase more housing supply, and particularly affordable housing. And there has been a number of announcements made, retrofitting existing housing as also building new. And I'm very appreciative of on the shelters. Right? I think where gaps are is that the need is so significant that investments are not keeping pace or catching up with that gap. And this is not a criticism of anyone. It's just the reality that no one have ever thought the kind of houselessness crisis that we would face coming out of COVID. Right? Like prior to COVID, there were close to 1,500 people who were houseless in Edmonton, and that was actually declining. But here we are, more than 3,000 people are houseless now. It's doubled, right? I don't think I think the overall, I think the challenge is that the social infrastructure has been underfunded, has always been underfunded, right? Now with more challenges related to housing crisis or houselessness, mental health, addictions, opiate crisis, we are seeing a lot of gaps and cracks in that social infrastructure. And that social infrastructure needs a lot of investments. So investments that are being made, I appreciate those, but they probably need to quadruple or more in order to make a real difference. Talking to them about having a different approach when it comes to urban indigenous housing and healing. That federal government has a direct role in providing services to urban indigenous population, as they do for on-the-reserve population. So that conversation is going. And having those conversations with the province as well as solutions are there. I don't think we lack solutions. It is proven by data and by evidence and research and best practice that housing first approach, where you house people, then you provide them wrapped around services for the challenges they're facing, works. It saves money, it saves suffering, it's good for the economy, it's good for the community, it reduces safety, it improves safety, reduces cost for the justice system, and it helps people heal. So models are there. I think we just need to have a commitment and determination to scale up those models.